they asked me to do this part about debriefing. Because for me, I feel this debriefing component of simulation is probably one of the most important parts, and probably the area where the participants, and I just want to clarify why I use the term participants, because some people say, why do you use that term versus students? Well, to me, my focus, I should tell you who I am first, sorry about that. I'm the critical care educator in the main hospital, and my main focus on education is with already hired registered nurses. And so some of those take offense if you call them students because they're actually signing up to come to a class, so I refer to them as participants. So I will use that term interchangeably today, or learner, I try and use a lot. But as I was saying, for me, debriefing, the setting up the simulation is a very interesting part. That debriefing part is where I believe that probably 90% of the education comes in with the students or the participants, whoever you are teaching, because that gives them time to self-reflect on what's going on. So first of all, I just want to give you a couple of definitions of debriefing. So Ralph and Mauser and Howard in 2000 defined debriefing as being the heart and soul of the simulation experience. And that's kind of what I was referring to then, is the really, in my opinion, I think setting up the scenario is what really leads you into the debriefing in most cases. Now, when you use simulation, and we've talked in other classes, there's a lot of different ways to use simulation. Some are tasks, and then those are just kind of the debriefing reinforces skills that they learn. But if you're using it for other, like teaching physiology or things like that, the simulator then, or the debriefing really sets up the review of what you're trying to teach. Also, Pamela Jeffries, who has done a lot with debriefing, saying, knowing how to debrief, which is why we're having these discussions, is because when I first started, I thought this was all pretty easy. We just did a simulation, and we went and talked about it, and I fell on my face for probably the first few years because I did it totally backwards. I lectured a lot in debriefing, and that's not the way to do it. So she really stated that knowing how to debrief really is as important to know how to, as important as creating and running the simulation. So what actually is? So Penny and Gala in 2007 basically said, debriefing is really a process where you reflect back, or where the learner is led through self-reflection and trying to decide for themselves really what they could do and what they could do better, or what they've done and what they could do better. I also like the Webster's Dictionary, just so you know. Back in 1945 is when they first used this term debriefing, and we've seen it on a lot. Debriefing was used a lot in the military. When I was in the Marine Corps, we did a lot of debriefing post bad events or good events or whatever. Crisis intervention should be debriefing. The other thing that I feel is important with debriefing is I don't think we do it enough. And I know we talk about debriefing and simulation. I don't know where else to bring this in, but I think this is a good place to bring in that, like any event that you're witnessing to in the hospital, a code situation, a crisis, whatever, I think doing a good debriefing is really important. And a lot of times before we started our nice Go Blue study, we used to run codes and then walk away, and everybody just stands there going like, and people would walk away later and ask, well, did I do something wrong? What could I have done better? And there was really no one there to debrief those.
I have a question.
Yes.
So do you find that we debrief more often when things go badly than when things go right? So should it just become something that's standard to debrief no matter what?
Yes. To answer
but
that
then
question,
where do we draw the line on what we debrief and what we don't?
Okay, so for me, well, that's a hard call. So I think any event that has especially an emotional charge to it should be debriefed. Good, bad, or indifferent. Some people will say every incident should be debriefed, but I mean, you do have to draw a line somewhere. But I think anything that could have a potential emotional charge to it. So like even if the code went well and the patient corrected, or like let's say someone becomes unstable in the hospital, bleeding out, whatever, you're giving blood products, those should all be debriefed on, not just, and I think this is where the big change comes in. We're not judging or debriefing just the events that happen. It's all the things on how do we get blood from the blood bank, how do we get supplies, to get something lost on the way, how could we improve that whole process to make it a better flow, or it's, it's sort of like the thing that they talk about doing incident reports, where you can track an event to find out if it's a system error or if it's an education error. So I hope that answered your question. But you do have to draw a line somewhere. You can't just debrief everything that happens every time something happens. Okay? So debriefing, as I said earlier, is the most valuable part. And this becomes the hard part when you first start working with simulation. Everybody wants to build these complex scenarios that run for a long period of time. Well, really, when you start thinking about this, the debriefing component of it really should involve about twice as much, at minimum equal amount, or even better, twice as much time during the debriefing as it does to run the scenario. So for example, if I'm setting up a class where I run an hour scenario, there's really 15 minutes of scenario running and about 35 to 40 minutes worth of debriefing. Because it really takes that long to work through, depending on how big your group is and depending on what you're running. And it is where they learn. I mean, I can tell you, getting feedback from people who've taken classes, a lot of them will say, I was learning a little bit during the simulation, but really our debriefing afterwards is where I picked up all the skills and really went back and looked at what we did well and what we could improve on. It provides immediate feedback. Before we go on, I should actually phrase, debriefing is, you have to be able, when you first develop your scenario, decide why you're doing the debriefing. And I didn't put this in the slide, but I think this is a good point because I state that it provides immediate feedback. First, you have to decide, am I doing debriefing or am I doing this simulation as a learning experience, or am I doing it as a testing environment? So I do know some people use these as testing environments. And the problem with the testing environment is you have to run the same scenario the same way over and over. And if there's going to be any interaction with the participants, then you almost have to debrief it after it's all over so you don't influence the group that's coming behind you. Or you need to do a block of group and then change your scenario. So, but for myself, I don't use it for teaching. I use it mostly for learning. I don't use it for testing. I use it for learning and teaching. So then the debriefing provides immediate feedback right now on how they did. And actually what I think the biggest benefit is, if you do the debriefing in a perfect world, you as a facilitator of that debriefing really aren't saying a lot. It's their own self-reflection and their peer reflection that are leading all the teaching. You're there asking open-ended questions to really facilitate that communication. Now, you do have people who just sit there and stare at you, so you have to be prepared to lead something. Okay? It gives them time to self-reflect on their strengths and area of improvement, and I also like to bring up to remember that the major focus of the debriefing is sharing of information. That's why, like when we do these series, and this is one of the problems I had when I first taught, is really we used to debrief with the lecturer or the facilitator standing up talking to you. So that puts an air of you are the instructor and they are the student. You should all really be sitting on the same level and discussing just like we are here. So, other thing, it allows for recognition and release of emotion. When people first learning how to do simulation, I think this is a big area that we forget. We're all jazzed about wanting to do about what tests they did, what pathophysiology I'm going to teach, all this other thing, and we forget that our simulations that we run may have an emotional charge to that person that you just ran, and that you may not even think about. So usually when I open my debriefs, I always look to see how everybody is feeling and what their faces look like. A perfect example of this was where I really learned this. I used to go, yeah. And I did all this. I wanted to be this educator. And what happened was we were running a scenario one time, not even thinking, but I put someone through a acute MI, cardiogenic shock. All of a sudden, as we're sitting there, we're talking, and I look over, and one of the students is kind of crumped down in a chair. And so that really made me interact with her, and I found out that her mother just died a week ago. Cardiogenic shock, post-MI, in the hospital. And she wouldn't have been able to learn anything if we didn't stop and address that. Now, I don't know how much she learned anyway because it was a very emotionally charged situation for her. But it's something that I think is important to be able to address are those emotions that come up during a simulation. And there are many. There are emotions in regards to family members who might have something happen to them. It could be that I have a feeling of inadequacy because I didn't feel like I performed well enough. And you need to get those emotions out of the way first, so that way you can go on to the rest of it. It also, this is also very important, I believe, is your debriefing also has to reinforce your objectives. Yeah, you can mess this up. Thank you, Bill. What Bill's passing out to you now is just it's like 7-page form of going over some of the stuff we're talking about today, sample questions to use as you debrief, etc. But I think the important part, and this is what I've learned coming away from it, was when you build your scenario and you're debriefing, your objectives need to match. It really gets kind of sidetracked when all of a sudden you start talking about things that are not in your objectives. Another way to rephrase it, I think is important to me, is if I'm looking at the scenario, the objective of my scenario is talking about communication or teamwork, some of the tasks they perform may not be all that important, because I'm really using the simulation to teach how did the team work together, how maybe did they respond to the leader who may have ordered a wrong dose of drugs along that line, not so much could they actually push the narcotic or the drugs into the IV line. Okay? Some of this comes off of Krebs' reflective cycle, which was made in 1988, which basically goes through what happened, what are your feelings about what happened, what went well, and what did you do good, and what could you improve on. What kind of, and part of the analysis part that I think is very important is what sense did you make out of this scenario? What did you take away from this? And then the conclusion is really, what would you do differently next time? And I think that's a big wrap up. Is really, now that we went through this and we kind of talked about all the events that we did well and could improve on, what would you take away from this that you would do differently next time? And a lot of times when you have all the time in the world, some people will do this, especially there's a lot of things that could be improved on and immediately allow them to go back and run it again. We don't always have that time to be able to do that. Driscoll's cycle also kind of goes along the same way. Basically, you go through the scenario, you look, I just gave you a couple different diagrams to use to look at, but the whole idea with debriefing or the simulation in itself is to come back and say, now that we did this, so what? What are we going to do with this event or these ideas afterwards? And develop a new plan. That's part of the critical thinking process that people go through when we are actually doing some teaching. So now, what are some of the goals of debriefing? I think that's important to think. It provides a safe place for people to learn. It actually encourages constructive feedback per themselves. So it is really a self-learning, self-assessment environment that actually provides communication among team members. One of the big downfalls I see when people are, and I think this is a culture change, to be honest with you, is I see a lot of times even the participants look at the person who's facilitating as the instructor. And they just want to answer questions when you ask them questions. And it's hard to get that facilitation of them debriefing each other and talking about it. Sometimes having a group watch, that helps some. It also promotes a culture, I think this is an overall benefit, that it's okay to talk about events away from simulation. That's one of the improvements I'm seeing as we are doing some of these more rollouts. And I do want to give the Code Blue team credit for this because I see nurses at least in the hospital come in and say, we had an event yesterday, can we talk about this? And I just saw that the other day up on one of the floors that you guys just did a code on. I meant to come back and tell you guys that. It was great because the nurses had an event where it was basically a respiratory distress. They called RT and got everything, but the nurse afterwards said, you know, I learned about debriefing. We need to stop and talk about what happened here. And she went through this whole thing of saying, so what did we do well and what could we improve on? And they found some little glitches in their system, like to get to their respiratory supplies, it was in the wrong place in the cart. So then they went back to their nurse manager and said, can we change the placement of the carts so our respiratory supplies are easier to get, because they had their linens before their, it seemed kind of stupid to me, like linens are more important, but that's the way their supply room was set up, was their linens and everything were first, and then all their respiratory supplies, which this was a place that dealt with a lot of respiratory issues, were the last one on the corner. So when I say it the other day, it was probably about a month and a half ago. So I just thought that was great to see nurses starting to debrief each other, because that's what we've been showing. So how do you debrief? So there are many ways to debrief. So I'm not going to go over the use of video and the importance of it. I just want to talk about there are uses for video, and some people do a lot of video recording. Some of us don't, and the only reason I don't was because I was taught in the old system where we had VHS tapes, and it took me forever to find the spot I wanted to talk about. And so by that time, everybody was asleep while I was fast forwarding, going, this spot here, oh, no, not that one. And so now that we have some DVDs, it's a lot easier to find the spots you want and do things like that. And I know Ali will be talking about that in 2 weeks. So I don't want to spend a lot of time about it, but one thing I do want to is sometimes it's intimidating. When people know they're being recorded, they act a little bit differently. It's the same thing with checklists. Some people like checklists. I found when I'm using a checklist during simulation, people think I'm grading them. And that's not my role, so I find that I don't always use checklists. Some people do. Group review, I think those are good for when you're doing team. You can't really do a group review if you're using simulation as a testing environment. That should always be done on a one-on-one basis if it's really a test for pass or fail or whatever you're using. So what are some factors that could distract? And some of these I can tell you came from personal learnings that I had. The first one was probably my first mistake I had. Lack defined purpose and objectives for my debriefing. I did a great job of putting 52 objectives on my scenario. I haven't said it. Multiply 52 is only 50. Okay? But I had nothing for my debriefing, so I basically walked in and went, okay, let's talk about everything that happened. And I had everything from washing your hands to the whole routine. Well, really, as I want to stress again, I think it's important to make sure that you develop only a couple of objectives. And the scenario objectives should match the debriefing objectives. Okay. Yes?
At what point during the simulation do you reveal the objectives to the learner?
Oh, good question. To me, and this is just my opinion, because you'll find in the literature it's all over the place. And some people say you should always tell them the objectives before they go in. I base it basically on what is my main target of the simulation. So for example, if I was doing nursing students, they would probably, or medical students, I might give them their objectives before they even came. I said, today we're going to do sepsis. Go read about sepsis, come in, we're going to do sepsis. If I'm doing a group of experienced nurses or physicians, I don't. If they're mid-level, I might tell them today's a pulmonary day. And so they're going to know at least walking in that the scenario should be something about pulmonary. And then if they're real experienced, like when I did a group of nurses just recently that had 15 years experience average, they had no idea what they were coming for. Because my goal then was really to pick up subtle signs. So to answer your questions, it's really tough because you don't know. I will tell them up ahead, though, the only thing that I would say almost everybody, if all I'm going to focus on is the communication or teamwork, I will tell them. My main focus here is working on how the team works. I do that more to relieve the team leader because they think they're being graded. So if you say you're going to do a team, then it makes everybody feel like they're involved. Did that answer your question?
It does. So for the
Not
novice,
very well.
Well, it does, but I think it makes sense for the novice providing learning objectives before to help them learn, but for the more advanced participant after.
Right. And to get off that, I also should rephrase that it would be also, if they're new to the environment, they're treated like a new person or a new hire, right? So like if you took me to OB, please don't walk me into an OB and expect me to know what to do. Because I'd be just like, don't push, let me go find somebody. and we'll come back, because that's all I could do at this point, right? So think about it that way. If you're bringing in someone into a new environment, then you might want to give them their objectives. Okay? Now, just so you know, you also have to be prepared that even though you set up your objectives, that something might happen in that scenario that may need to take you all the way off of the scenario, that would not be your main objective, such as someone grabbing a defibrillator and shocking someone who's still a mannequin who's still talking to you, right? Then your objectives may not be talking about the teamwork anymore. You might need to talk appropriate use of the defibrillator. Okay. Other things is excessive instruction. So for the facilitator talking too much, for example, this was one of my pet peeves, or one of the things that I fell down the most on, because I was taught to lecture. So basically I said, so when I did my first simulations, and I will tell you how I got taught. I got a lot of instructions on how to teach before I started using simulation. We got told that we had this simulator downstairs in the main hospital, and since I just took the job as a critical care instructor, I better know how to start teaching them. So I said, good, when are you going to teach me? And they're like, well, it's downstairs, they're doing a class tomorrow, and they don't have an instructor. Great, so that's how I learned. So, in a way, I fell on my face a lot, because I wanted to teach just like I did standing at a podium. And that doesn't work very well, okay? Closed-end questions, that happens a lot when you first teach, because you ask questions, why did you do this? You tend to ask questions more about giving feedback than it is really opening the discussion to allow them to self-reflect. For example, did you do this? And they'll say, yes. Well, that's a closed-end question. You don't offer any kind of feedback, and it kind of stops the debriefing. Allow discussions on, this is another one. I will tell you, when you first start using this, everybody in the debriefing wants to talk about the limitations of the simulator. There are certain things it cannot do, and they'll want to talk about that. And they'll be like, oh, I missed that because it didn't do this. Well, you can't let those go, or it'll take up your whole debriefing time. So you just say, these are the limitations. And I tend to tell them that right up front. When I walk in, if I'm doing a neuro, I'm going to say, there, can't squeeze your hands. Okay, you just have to, I will tell you they're squeezing your hands now. Okay, things like that. And then once again, not underestimating people's emotions are a big distraction to simulation. Things to, I know this is repetitive, but these are also, I just want to reiterate that besides the objectives, the complexity of the scenario. I think that is probably one of the things when we get into scenario development that I think we all had to learn the hard way, was a lot of times we made our scenarios way too complex, and we wanted to talk about way too many things, and then before you know it, you had 52 objectives, because you wanted to do everything and make it, you have to build up on those. And remember, you only have a few minutes to do all this in, and also then debrief. So some of the things that have to do is the complexity of scenario. And what is your goal of that scenario? I'll give you a couple of examples. I mean, we use scenario or simulation for task triggers, right? So sometimes we want to see how do you perform in a code, and that's kind of the task involved in the code along with the communication. And there's other times where, and this also, you have to think about this when you develop your debriefing. For example, I use it also as teaching people how to notice the nuances of a patient developing ARDS. And I use it as an adjunct to a lecture. So basically what I always do is stop them at the midpoint, talk about how the patient, the monitor, and the ventilators fit into a patient developing ARDS. When I used to do that as a lecture, I was going back and forth between PowerPoint slides. I made myself dizzy half the time. You remember 3 slides ago, this is what it looked like. Now look, what you can do in simulation now is you go, now look at the patient. How did they feel when you were bagging them? Did you notice that when you were bagging, they were getting a little bit harder? You put oxygen on them. Their SATs didn't come up. That's the, the refractory hypoxemia. How did the vital signs look? And so you can put that whole picture together and then talk about what is ARDS, and then pick it back up and then fix the patient. So there are many different ways to do that, and that's something that you're going to have to decide in your scenario for your debrief on, do I want to stop them, or do you want to do it the way a lot of people teach and say, you never stop them, and you let them run their whole scenario, and you do all your debriefing at the end. And I don't think one is right or wrong. I think it depends on what you're trying to teach at that time. If I'm trying to teach skills or tasks or communication, then you let it run and see if they correct themselves. But if you want to do putting the picture together, then sometimes you want to stop it in between. Okay? Other things is individual personalities. This is kind of a little tough one because sometimes you get people who have different personalities that you have to deal with. Also, we have found, and this is why we always tell people to wear uniforms, is people will act differently if they come in their street clothes. They get a little defensive, distracted, things like that. So where should you debrief? As we mentioned a little bit, it depends on what the goal is. Ideally, you should debrief in a place away from the scenario. It allows people to disengage from the mannequin. If you can't do it in another room, then really what you should do is step away from the mannequin. And I still have a problem with this because I want to start debriefing all the time. And really what you should do is walk away from the mannequin even if you can't get out of the room, so you're not over the mannequin. We tend to want to talk because we lay our papers on top of the mannequin with a sheet in between.
Signature on the mannequin.
Yeah, signing papers on the mannequin, things like that. Sorry, is that a teacher? But no, if you think about it, that you don't break the engagement into the simulation if you don't have them step away or go to another room. We also found when we were doing a class just recently that letting them walk across the hall or go to another room also can decrease some of the anxiety that they had during the simulation. Okay, so just had to think about that. So also thinking about seating styles. I think that's important no matter what we do. I just went to a class the other day and we had to stand there for an hour and a half. After about 15 minutes, I was more worried about the way my feet were feeling than I was listening about the new Pixis upgrade. Yes?
Just a quick question. When you mentioned moving people from one room to another, I noticed sometimes, and I wondered if you ever tried this, people will start their own conversations if you give them enough time. Mm-hmm. Do you ever give them 5-10 minutes alone to see what arguments ensue, and then use that to help facilitate the debrief?
Yes.
Yeah.
Actually, I never did before, but that's one thing that in a class just recently we learned that sometimes if you just sit back and let them start talking,
yeah,
you don't have to facilitate hardly anything at all. You just they'll work it out a lot of times.
Uh-huh.
So yes, I think it is good. And depending on the emotionally charged environment, you may want to even have them go to the bathroom and come back.
Yeah.
Because we found that out in one of the classes that there was kind of this emotional charge, and the person who was there came out still kind of amped up. And then we started debriefing, and they were just amped up the whole time. They're like, you should give me a break, because I'm still amped up too much, right? And so that was really a good point that, depending on what you're doing that time, it might be important to give someone a couple of minutes break. Then I think video recording would be a good benefit also to have, because then if they forgot any part of the scenario, you can go back and play.
During the emotional charge, immediately, once they finish the scenario and you start to say anything, some students, they have like mental block.
Right.
They just need like a few minutes just to move to the debriefing mode,
Right.
Especially if it involves emotions.
Right. And it would really be nice if you had all the money and time and facilities that you have in the world, is to actually have a room like this where you could come over here that you would have water or coffee or whatever in the room to give people time to pour their coffee, get to drink of water, sit down. I know when I'm time limited, you're lucky to even get a drink because you're like, okay, we're done. Let's talk. And I think it does make a difference to have something to drink, a comfortable place to sit, maybe go to the bathroom before you start, whatever you do. So I also agree, especially emotionally charged, because they just get in this blank. And I have found, especially if someone makes a mistake in the simulation, then really all they are is like, oh, I screwed up, I screwed up, I screwed up, I screwed up. And you try and tell them that the good things they did, they're like, I screwed up, I screwed up, I screwed up. Right? So sometimes if you let them take away and go, and then start talking, they lose that block that you were talking about. So
I think you. I'm sorry.
No, go ahead.
I think you bring up an excellent point, though, because this is like real life. When we experience trauma with a patient, we are like that. And yet, many times we are sort of jump right back into that battle, right? And so using that as an opportunity for reflection, that this really happens, sort of monitoring yourself and saying, how do I process this? Maybe I just need some time.
Well, and going back to where some of us who were trained many, many years ago, we've taught ourselves how to do that, right? I remember when I was taught, it was like, don't show any emotions, deal with it, and then let's move on. And so we walk away from that. People learn that, and I agree. A lot of times we're just like, okay, that one's done, let's jump back in, and that is real life. And I think that's one of the things that we need to take away from this debriefing, besides just simulation, is people do need the time to decompress before you throw something at them. And I'm a big proponent that this happens in the hospital a lot. Patient dies, 5 minutes later you have the supervisors calling you, aren't they out of the bed yet? I have a patient for you in the ED. And it's like, we just looked at this patient, what do you mean? Well, we got another patient coming out of the OR, hurry up, right? And they don't give you time because that's not the way we work. We were supposed to, and we were probably all trained that way. Come on, get over it, let's go on to the next one. You'll deal with that when you go home. Right?
So when you think about students in that same setting, like for example, sometimes we run scenarios that are pretty, remember the one you did with the senior students, I remember there was a code on one, there was a pacing on one, and I think there was another one, I don't remember, and you were there too, and we did 3 in a row, and they were still, everyone who came out of Ollie Station was so charged to work a code. They were ready to start delivering a pacing patient who was still talking. They were still so charged from it because there was no break, and I don't think we debriefed at the end of the whole thing. I think we didn't debrief at each station because you're right, we're running short on time. You only got. So I'm wondering if it makes more sense to do less stations, more time in between, give time for all that blood pressure to come back down before you start the next one.
See, I think you're walking on a very important part. If you can make the time, you almost have to. I have personally found that I did this before too, where you did 3 stations and then try to talk about them all at the end. That doesn't work. You have to have at least time to debrief each one individually, or they start getting their scenarios mixed up.
Yeah, that was exactly what was happening. Yeah.
And you'll also find that if someone and I find this even now, even though we do debrief, but we don't give a break in between each one, we still have that problem. Like when I run a community course here, and we only have 45 minutes, then you got to get to the next station, go to the next station, and we don't give them a break in between each one. It's just like go from this room to the next one. It's amazing on how, even though they got debriefed on a code, the patient will snore and they're ready to take their plate. They have a pulse, they have a blood pressure, but next door they were coded, so everybody's going to code.
Yeah, I mean, they had set
up. And you have to break that anyway because a lot of people who come to simulation thinks all the patients are going to code. I always love to say, well, they just needed a new one. You didn't have to intubate them, you didn't have to do all this other stuff. They had some wheezing. But it's amazing, they get wheezing, let's call anesthesia to intubate. I'm like, your sets are 98%, you want to intubate? Why? Well, they're going to code, I know it. Right? That's what they all want to do. So I do agree, if we could set this up better. Now, we are also limited with our times and instructor time and sim time and student time. It's something that's very hard to do, but really it'd be nice if you could do one, debrief it, let's take a 10-minute break. Now let's switch stations.
It's actually less faculty intensive instead of doing 3 or 4, we're doing 2. You are doing faculty block.
Well, and also if you think about this instructor-wise, it actually gives you kind of a break to decompress too, because I can tell you, I've run 4 in 4 hours with groups running through them before, and I'm like, what did we talk about last time?
It all runs together.
Yeah, because you didn't give yourself time to decompress in between. So even if it's 5 minutes, let's take a 5-minute break, go to the bathroom, come back, let's start another one. I think it's a good thing to do. Anything else about that? I think those are important things to really think about when you build your scenarios. And we try to punch too much in, and I still do that, to be honest with you. One, because we're limited time. When you only get them for three 8-hour days, you have to get as much in as you can, and you really find that you do build up too much in a short period of time. I think they get a good learning experience, don't get me wrong. I do think if you don't debrief each one though, then everything gets confused. And they can't remember what they did at one versus the other. And as an instructor, I found myself then getting the groups mixed up when I tried to talk about what one group did well and the other one did, and I'm like, I can't remember which group you were. The other thing I just started developing now, and I think it's working, I think I like it. I'm hoping the people take away with it. I've always now doing an end of the day debrief. So we debrief every scenario, but then at the end, we all come back as a whole 25 or how many is in your group, as a whole group, we debrief on how it all went. That way, if there's any questions that got left unexplained, they could then bring them up. Because I mean, like as most people here know, if you're running where you have to switch stations, you may not be able to get a full everything I wanted to say in that debrief done. So it gives you time to come back and wrap up. Or they'll say, you know, the other instructor told me this, and you told me this, so I'm a little confused. It gives you time to clarify that. Where both of you were probably right, it was a different scenario. They were just a little confused. And if they just went home, it doesn't leave you time to clear those things up. Or the emotion of the whole day.
My thought was is if you mix it up and it's not a complete scenario, but it's like a practice. So Sam has done that a lot. She will have a case, but then the other stations are not another case. So you can do that break and that debrief. Yeah. But the other stations are lighter. And
they're components of that, but I mean they're related in the components, but they're not the whole thing.
So I wanted your opinion on how that works. In essence, that there's more time in between, and they're not so charged because then they're going to go to a station that's lower stakes. There's not a case or a worry. Right. They have to perform exactly.
Right. Perfectly. So sometimes I like that. Okay. The part of that I always feel is the detrimental is since you're having groups who rotate. Yeah. Sometimes a group will have to go right into the big sin first.
Yes.
And then they get all the prep stuff working up to that at the end.
At the end. Right.
So I've always tried to, and I did that in the beginning. Oh, this will work out perfectly. I never thought about, well, one group's going to jump into the big heavy one, and then go find out this is what an ambu bag is, this is what oxygen is, but they're already doing a respiratory arrest code over here, right? So the way I get around that is you still have you can still set up the skill stuff, but you should make almost everyone individual. If you can't make them sequenced, where everybody gets to start early and work their way up, it's almost you need to make that big sim almost something else, or have a way to do a rolling scenario. Does everybody know what I mean by rolling scenario?
Not exactly.
Okay, rolling scenario is like, we do this with the mechanical vent class. Same patient going through different phases.
Nice.
One part of the group will watch the other perform, and then they switch roles, but the patient will changed, and the patient's just a couple days later or hours later or something along that line. That way you don't have to repeat the whole history and do all that kind of stuff. And that helps, but you have to have the room to support having group watching and doing that, and then you might not get some of the skill stuff. Mm-hmm. So I think those are just the limitations of our time. See, ideally it would be great to come for a skills day and then come for a sim day. Mm-hmm. But I mean, a lot of us don't have the money or the time to be able to do that. Did that answer your question? I think it's a tough one. I wish there was a good way around it too.
I like the separated skills day from
You don't always have the luxury.
Yeah, you don't. Sometimes you have to do them together. And then the emotional part, a lot of it is to set the expectations of what the debriefing is going to be about. So a lot of this we've already talked about, using open-ended questions. The best way to do that is be begin questions with what, how, or why. I have learned from experience, though you need to set this up before, that you are asking, and it's the way I always phrase it however it works for you. I always say, I'm going to ask you why you did something. Does not mean it's right or wrong. I want to know your thought process behind that. And then I always want to explain to them, like I said, I teach nurses their experience. And I always say, all of you know how to follow orders. That's not what you're here for. I'm here to help your critical thinking, so I want to understand why you chose to do something. So that when I ask you why, that doesn't mean you were wrong or I'm challenging you. I want to know your thought processes. I have found that a lot of participants, if you go, why did you do that? They'll be like, oh, well, I should have done something else then. Well, no, I want to know why you chose that drug or what was your rationale. So sometimes I'll do that. What is your rationale for that drug versus another drug that you could have used at this time?
Sometimes we give them the time to figure out the background, why they did this or this. Many times, actually, they tend to be correct.
Yeah.
Epinephrine, for example, they should have stopped it immediately once they recognize the errors.
Right.
But some of them, they will say, I can tell them why you didn't start epinephrine instead of you should start.
Right.
So they told me, okay, I think it was ischemia, so probably I don't want to exacerbate the ischemia.
Right.
Or maybe I think my colleague, he said, yes, he get it. So then I turn to the communication. So what you will do, you should do like closed loop communication or direct orders and so on. So figuring out the background, beside the great point that you mentioned, is just that's neutral question. It's not you are wrong or you are right.
And I think, Ali, thank you, that's a good point, making sure that it's safe for them to say whatever they want to say. The other thing I ever tell them is that it's unacceptable to me, I just say, so even if you have to guess why you did it, please think of a reason why you did it, not just because this is why we do it. Right? Yes.
I have a question about the non-judgmental portion. So I was debriefed by the master, Dave Gavin.
Yeah.
And that experience was interesting because he basically, very stone-faced, right? He asks you questions in a very reflective, nice, non-threatening way. But, I did really well in the scenario, but I didn't get any of that from him. And oftentimes the learner is looking for that, some sort of positive reinforcement, like, hey, you did a great job when you recognized there was ST elevation in that. That's kind of what we expect as learners. Mm-hmm. His approach is, don't do that. That sort of enforcement, positive reinforcement, maybe it doesn't have a place in debriefing. So what are all your thoughts on how you do that?
It was weird.
Oh yeah, you were
there.
So you know.
So even just watching you speak, everybody in the room, or at least 2/3 of the people, are nodding because it's culturally polite to nod. So Michelle's nodding, and then you're getting that validation of your communication. He was nothing.
Yeah. So personally, I think we use the term too rigid sometimes. There is no such thing as a non-judgmental.
Right.
We all make a judgment, and we do that. The idea of that is that you're not supposed to go, you did this wrong.
Right.
Right? That's what the term really meant, was you're not supposed to, you did this wrong. It's more like, so what could we improve on to make it not as a error, but a learning environment, and not putting a judgment on, because depending on where you were trained, you might use an intervention when there could be 3 that you could choose from. It might not be the one I thought you should use. And so I've had people debrief me that way too, and I'm like, I'm getting no feedback from you at all. Mm-hmm. And it's great that my team and I all think we did a great job, but maybe we sucked. Mm-hmm. Right? But you didn't tell me we sucked, so we walk away. Or I can't tell if I did a good job.
I mean, it was a good experience. I got good feedback. I just was sort of looking for a little bit more.
It's that emotional feedback.
Yeah.
See,
and that's hard for me to do as a debriefer.
Right.
Is to hold that back. It's not, that's not my nature as an educator.
So the way I use non-judgmental theory is when they are talking, I don't use any judgment at all. Then I always wrap up every discussion where, you're right, I thought that went very well.
But what if it didn't go very well?
Yeah.
And I've seen opportunities when, you guys did a great job, but we really need to work on this. And clearly the patient was dead from the get-go. They never intubated. They never got the crash card. They're fumbling around with the lead wires, and the patient's been dead for days. But you guys did a really good job, so let's discuss some of this stuff.
So just so you know, personally, I try not to do that because I think you said mismatches at that time. Yeah, I'm just like, here's an area for you to improve on, and this is what we need to improve on. And I actually think non-judgmental is a good thing to think about, but I can tell you there are times that you just have to say, you know what, we need to redo that because that just did not go well.
Or even stop it. I mean, when it really is clearly going down the tubes,
it's going down the tubes,
whoa,
stop it. Yeah.
okay,
I know.
stop. This is not working. We have to regroup.
I've seen Ali do that with our students before, where it's going down the tubes, and he'd be like, "Okay, let's stop and talk about this for a second."
Exactly. Yeah.
And then pick up. Remember, for a couple of the scenarios we've done, people actually just stop them, talk about it for a second, and go, "Okay, let's go back and see what we're doing here."
So that's actually a good technique I've also used, and I know this is going off the judgmental part, but really, to me, and this is everybody has a different thought process. And that's where I say, some people just think you let them run and they flail. I think that's not a very good learning environment. Especially if they're going down the wrong track. Like if someone's in cardiogenic shock and they're thinking they're bleeding out and they're just not getting it. I don't think it's good just to let them loop. So I always explain when I start the day, I will pause you. I've learned to do a difference between pause and stop. Only personally, for a safety issue, I've learned to differentiate my term pausing and stopping. Stopping means the scenario is over. And the reason I do that is because if you work with the Medi product, every time that you finish the scenario, you have to reboot it. And when I didn't tell people, okay, this is a stop and not just a pause, I actually had someone push me out of the way to start chest compressions while I was talking to them. Because the monitor went flat. And they're like, oh, shoot. Pushed me out, I was against the monitor. So I have used the term pause, which means I'm pausing the scenario. So nothing's going to happen to the mannequin. And now we need to regroup. And then I do a mini debrief and I say, so let's talk about where are we at? What's going on? How are you feeling about this? Because a lot of times it's emotions that get them blocked. And that's why I say non-judgmental. I'm not a big buyer that I try to be non-judgmental, but sometimes you just have to say, you did a good job. You should be told you did a good job. Right? I don't think that's what they really meant by that. I know Gabba takes it to an extreme, and he always.
Well, yeah. I mean, it's not. It's just it's kind of subtle. So, like, let's say for example, there's cardiac arrest. Nobody started chest compressions. He wouldn't say something like, what are you thinking? That's part of the ACLS algorithm. Right. Why didn't you start? What he would say is, so what do you think the downside to not starting chest compressions is? Has that happened to you before? Anybody? Right? That's how he would sort of spin it.
Yeah.
So it's a Socratic method, really.
Very much so. Right. And then follow up, and how did that make you feel?
Yes. Yeah. What was going, and he also says, what was going through your mind? What were you thinking about at that time? Have you been in that situation before? So a lot of sort of reflective, metacognitive activity.
Which is really good, to be honest with you. I like that.
Written books.
Right. But I do also think, especially, you're very experienced in this, so you know when you did a good job and when you didn't. Sometimes with students, they don't always know that, and I think sometimes it's okay to say, but I think you guys did this part of it well. I agree with you. See, I like that term. To me, that makes it a little bit more non-judgmental. Is if they say they did a good job, then I say, I also agree with you. I thought that went pretty well.
Yes.
Because then you're validated.
It also goes back to the learner level, don't you think?
I agree.
So with a novice, this is someone that might need a little bit more positive reinforcement. The expert, that's not the goal.
No.
That's not where they derive their energy. It's their self-satisfaction.
Perfect. And I think that's the big component. You have to know where your learners are.
And does it not matter too if it's evaluative versus formative in that context?
Yes.
Right? I mean, that also makes a delineation. If it's formative, the stakes are lower. I don't know. I'm just throwing that out.
And I think all those are things that you have to think about when you go into this, because it does matter. Perfect example, doing someone who's brand new into an environment, like taking someone from one area to another, and not allowing them to be okay, knowing that they did okay, and you're expecting them to evaluate themselves on if they did this appropriate or not. That's kind of a hard one to leave out there. But on the other hand, if I got a 15-year experience ICU nurses group coming through, they should know if they're doing an intervention right or wrong.
Right.
Or at least to know that this teamwork didn't go so quite so well. Right? That's a tough one. And I do know that they really do teach always non-judgmental. I thought it was very interesting. There's also a paper out there saying, can you ever do a non-judgmental debriefing? Some people believe you can never do that because you're always got an underlying judgment out there. And you show it even if you don't. I mean, Dr. Gavin is very good at being stone-faced because I've seen him. I'm not quite such a good poker player. I usually give it away and smiling and getting it done.
Yeah.
But he's a very good poker. I wouldn't want to play poker with him.
You may cover this later, but it's another question I had.
Yes.
How do you measure the effectiveness of your feedback?
Good question. Not very well. No, just so you know, not very well.
I suppose you give surveys, right, to your
Evaluation review.
Yeah. But are there other ways?
There
Peer evaluation, or
there are like what's that score that we used? It's like a template that they already validated to evaluate how effective is your feedback. So this was developed in Harvard Institute for Medical Simulation. It has all the components, and they have student version where the student can evaluate your colleagues.
Yeah, and it's reasonably well validated in terms of what people said after multiple feedback sessions, all the elements you have to hit. But for us, if we don't use that tool, and sometimes we don't because you can't do it non-contemporaneously, you do a video or something like that, we rely on surveys, which are not always great, let alone the response rate.
And there's a lot of things, you use evaluation tools. Yeah. A lot of those, I think there's still a lot of areas for improvement in there because, one, I think the tool that they're referring to is a very good tool, depending on when you give it to them. Sometimes immediate, right there, we just had feedback, how did that go? Everybody's like, yeah, great, let me go. Right, so I actually would like to see using the tool and then maybe following up after they had a day for it to register and see how that went. Most of the time we don't follow up with people because we don't have captive audiences. I know some of the schools do. We ask questions like, so how did this, at the end, how did that scenario go for you? Did you find like you had positive feedback or not feedback? Did the debriefing was positive thing for you, or were there areas for improvement? I find those are hit or miss coming back. I see a lot of.
Yeah, I think we leave out debriefing the debriefer often.
I agree with you.
Well, and I think one of the things that, as you talked about, is depending on how you do the debriefing, is the debriefer may not actually give any feedback, or so there really isn't anything for them to evaluate, because the debriefer was really kind of just facilitating the conversations, but really didn't have positive or negative to say, just kind of encouraged self-reflection and other people. Yeah. So
that would be a good debriefing.
That would be a good exactly.
And I think that
sure.
And I think that's the toughest part about evaluating a debriefer is because depending on what happened, you may have to debrief a totally different way.
Yes.
Right? And so to develop a tool that said this was a good debrief or a bad, well, like I said earlier, my best debrief is when I said not one word. I walked in and they're already talking and I'm like,
I did one time where I had them just do a paragraph of reflection, and then they submitted that to me. Yeah. And in those reflections, there's a comment about maybe the facilitator, which was a part of it. But again, it's not about us; it's about them.
And Sac State does something similar to that with their nursing students. Is that they will, after they finish the debriefing, that day they have to write a self-reflection paper. including on how the debrief went, how they participated in the debrief, all of that.
I'm talking like 3 lines, just real fast, and they do it right away.
Right. And they do that, and there's feedback that way. I find doing people who are already new hires, they're like, I don't want to do that kind of stuff. They all circle 5s or 4s, and then they go, yeah, great, see you later. So I think we're all at a different place. I think the medical student might be a little bit easier to get feedback on your debriefing than maybe your fellows. Or even taking the next step, your peers as attendings to get feedback.
I think you could also use the same mechanism you use for debriefing to look at to reflect your own skills and videotape yourself doing the debriefing, and then see how much smiling and great job and stuff do you do, and how many closed-ended questions, because I don't think we know how we come across. You know, it's much easier to look back and you go, whoa, I did not know I did that.
Many times it's painful.
Very painful.
Yeah, so you don't let anybody else watch it. You just
for your own personal
growth. Exactly.
Yeah.
Now, and that's one thing that we walked away with the class, Peggy and I talked together, was wouldn't it be great to video the whole debriefing process, because then you could see how really you did. Other places I have seen, like Wiser, they actually periodically have a person who comes in and observes your debriefing and then gives you feedback as a professional to professional.
Yeah.
But then I think that also leaves out, so how did the participants feel like you debriefed? Because I may observe you and go like, yeah, but the students might go, hey, wonderful job, I learned so much through that debrief. And I still think debriefing is a tough one. I think running a sim is easy to kind of say, yeah, you did, that was a good way to do it. A debriefing, I think a lot of times, even though we try and set up as you do this rigid thing, you have to read your audience too. And sometimes you might have to do more inching out, or I'll give you an example. We had a nurse who thought she did wonderful, no matter how much we said, oh, here's your area for improvement. She's like, oh yeah, I did wonderful. I'm like, oh, really? Well, at one point you had to say, stop, you did not. Okay? I'm sorry, I'm judgmental.
That might have been judgmental.
I'm sorry, judgmental, but no, you did not. The patient was in B-fib and you were giving them atropine.
Well, why do you think you did so well?
Yeah. And what was interesting, yeah.
Tell me why you did so well. I'm really confused.
Yes, in B-fib.
I like that. Yeah. What's the downside?
Which, to be honest with you, would be great if you had 12 hours to debrief someone. You could probably go through the whole process of going like, so how did you feel when your patient died from giving you a record? So I think it's a tough call. And I wish there was a good tool that you could use. I haven't seen a tool that I would say, yeah, I could implement this on everything I did.
Thank you.
Okay.
Oh, we're still on. Sorry, I gotta go to class. Thank you.
So a couple things I want to bring up for as we go. The other thing to make sure is we have to include everybody in the group, not just the team leader or whoever was leading the scenario. We should include everybody. Be careful with their body language. And the other thing is, I think, facilitating. Remember, we are facilitating their self-learning and their critical thinking, and going along with developing their own problem-solving skills. I think that is also one of the biggest ones, is we want to tell them what they did. I think most of this we've already covered. Basically, having them self-evaluate themselves allow them for longer retention and better retrieval, and they learn that everybody takes an active role. Biggest thing I want to talk about now is just the process. And this goes along with, we're not going to, how would you do it? Basically, you want to introduce what the whole purpose of the debriefing is, their personal reactions, which we've already gone, and how to discuss. So basically, make it a self-environment, communicate the expectations to all the participants, allow the student to explore and deal with their feelings. So things like, how did the scenario go, are some of the questions you might want to ask. How are you feeling? How did this whole environment go for you and the team? Also, some of the debriefing, this is the positive, negative type things. Some people use pro cons. A lot of people use the plus delta. So what did you do well and what could you improve on next time? I call myself for the longest time using the term, you made a mistake. I had to break myself of that. It should not be you made a mistake. There is an area for improvement. But it's okay to say you made a mistake. But I know most of the time they talk about using the term areas for improvement instead. These are some of the things that came off of one survey that I saw, or one way to debrief is make everybody say at least one thing that went well. Because what you find is a lot of times people will hold back and you have to include people. So have everybody say one thing that went well. What were you thinking? This is another thing that Dr. Gavin does a lot of. What were you thinking at that moment? And what are areas for improvement? Once again, what did they learn and what are they going to take away from this? And have them give examples of what they might do differently in the future. Make it a non-threatening. It helps capture the aha moments. Find a way to tie this back into real world life. And the big thing is, in summary, actively listening is the hardest part. And I think one part that I kind of skipped over is the silence. As for people who debrief, how hard is it to be silent? When you open it, leave an open-ended question, that 10 seconds is a long time to wait for feedback. But if they're self-reflective, you can see the wheels spinning. Sometimes it's good just to be quiet and let them go. It's almost like giving a tendency, right? It's a long 10 seconds.
But that works really, the silence works well for the introvert who cognitively processes this stuff, and it takes time,
Yes. Introverts are sometimes even more than 10 seconds you need. That's why you got to look at expressions and see, are they really processing or are they just gone? Right. Also, you have to watch that there isn't one person in the group who is just overriding the whole other group. I find that's a hard thing to deal with. When you have one aggressive person who always wants to take over, sometimes you have to tell them, okay, not your time now. Be quiet. I want to hear from this other person. Other thing that, as that we all know, we've all talked about, what happens here has to stay here. We have an event that happened just recently in a class I taught where one of the instructors reported back to this nurse manager on how they perform. And it's almost 2 years to break that. So I don't think that's our place, and we should not be put in that position. And actually, they were put in the position where the nurse manager came and addressed them and said, I need you to tell me how they're doing because I don't think they're performing well. And she basically told them. Now, that was not someone in this hospital. This was in the community I did, but it took us almost 2 years to get that trust back because it was kind of broadcasted that that's what we did. Keep an open mind and keep the debriefing moving is some of the hard parts. So, yes.
Can I ask you about the inclusion part? Because that can be a challenge. You've got a group, and there are always those that are not really, they're thinking, but they're not really participating. The round robin at the end can help. But what are your thoughts on calling on people, who maybe aren't talking a whole lot? What do you think, Francisco?
It's starting to get closer.
Yeah. So I do call on people.
Yeah.
Because I think a lot of times,
there's a silent group.
Well, I can tell you, you'll probably have 3 or 4 that are really quiet, and I will start by making direct eye contact with them when I ask the question. And if that doesn't work, I'll even say, I want to hear what you thought. And actually point at them, and that puts them on the spot. And then you'll have their coworker try and jump in, and then you have to say, I do want to hear. Because what you do is, like you said, those introverts, they take a long time to process. And then there are certain people that want to feel like maybe Francisco is going to answer for me, so I can just be quiet over here and I don't have to answer. But really, you have to get everybody involved, or they might have things to ask and walk away and they get lost. So I think it's okay to call on people. If they start to shake and quiver, then I'm going to call on them a lot. Well, because you just have some people who are nervous about talking in front of their group, or they haven't chilled down yet or not. Then it doesn't work so well. And then it's interesting. I found people who won't talk if you're over the mannequin. but you put them in a room and sometimes you can't stop them because they broke away from the environment that they're stressed out about. So the round robins help at the end too sometimes. Anything else?
Thank you.
That's all I have.